Here sits a midwife who've had mastitis with all 4 babies of my own.
Yes, I turned up at Angie's house once suffering terribly from mastitis, and I really thought I was going to die.
I remember waking up in the morning with very full breasts and feeling quite achy and feeling quite hot.
Mastitis is a blocked milk duct that the blockages cause the milk to seep out into the surrounding tissue. It's not necessarily an infection. Even though the body may instigate the infection response, which is redness, you'll get a red inflamed boob, you'll get flu-like symptoms of headache, shivering, temperature.
You get this lump, and no matter how much I was expressing it, massaging it, it just wouldn't go away.
I mean, it was like a marble.
And I was going hot and cold and just felt awful.
You looked very ill.
And death would have been nice at that point.
Every movement I made, even as I moved my head like that, it felt like I had a vice on my head, and my temperature just shot up immediately. So it was a matter of 20 minutes. It just developed, and it was just horrendous.
And I was shivering and I was all over the place, but I just assumed that it was, my body temperature was a bit funny because I'd lost my little bun in the oven, I lost my little baby that was keeping me warm on the inside. One minute I was, sweating all over the place, the next minute I was shivering, I couldn't control my body temperature, I felt absolutely dreadful, but I did let him suck it out of me, basically.
Despite the intense pain of mastitis, it's often overlooked or simply not recognised.
You can easily miss it. It's only through hindsight. Looking back, I know that it was mastitis rather than me being tired.
I think I just felt so dreadful after the birth that I didn't even acknowledge it as such, and I didn't recognise it. But, I was assured by lots of people that it didn't look like mastitis to them, but then again I am dark-skinned, so what probably didn't look like mastitis to them, talking to lots and lots of women that had it, I think I probably had it.
There are many ways of treating mastitis, from antibiotics to natural herbal remedies.
So first of all, deal with the symptoms. Take your paracetamol and get rid of your flu-like symptoms so you feel better. Then try and deal with your blockage, or simultaneously deal with the blockage, which is massage. Massage the red area down towards the nipple. Best time to do it is when the baby's feeding, because the baby's doing its bit to unblock, get the blockage unblocked, and massage the breast down towards the nipple. Hot compress, cold compress.
Painkillers really, just your normal, Nurofen, paracetamol, to just keep the temperature down.
And I took we looked it up in a homeopathic book, and I took 1 dose of the remedy. Felt better within about 20 minutes. It was belladonna, I think, was indicated for the symptoms I had. And so I just took 1 dose of that, and I gradually got better over the day.
You don't need antibiotics. Vast majority of the time you don't need antibiotics. It's not an infection.
Because I was quite sort of anti the whole antibiotic thing. I don't think I've ever taken them when I was pregnant with Kai.
At that stage I was monitoring my temperature, because if you have a temperature above 38.4, I think that's the point that you start thinking that infections will develop, and you really then should consider antibiotics. If you're, I'm not into antibiotics and I don't really take them, but this time I did, because I was doing the breastfeeding thing, and I just didn't want anything to actually to affect it anymore.
The thing that I used to do was fill the sink up with nice hot water, as hot as you can bear it, and then pop your boobs into the nice hot water, both boobs, and massage down towards the nipple. That way you'll release some of the milk. Your baby will be able to get onto the breast much easier in order to drain the breast. Get it drained and the mastitis will work through.
Andrea gave me a really, really good tip. When she was training with the Albany group practice, there was one midwife there who, for 12 years running, I'm not sure whether I'm good, for 12 years running, won awards for her dedication to breastfeeding. And her top tip for mastitis, because you've got the engorgement and the baby can't quite empty the breast, and you really want the breast emptied to actually alleviate the symptoms, she actually advocates that the partner empties the breast for the woman because their suck is much stronger than the baby's.
Did it work?
It did. And I said to Andrea, I'm going to have to try it. Not because I fancy the idea, it's just so that I can tell people and see how it looks on their faces.